For seniors, deciding between traditional Medicare and a Medicare Advantage plan is one of the most difficult choices you'll have to make. In this video, I'll share my opinion and break down the different choices so that they're easy to understand. Unfortunately, most information and educational content on this topic are produced by insurance companies or insurance brokers who may have something to gain by the choice that you make. My name's Justin. I'm a physical therapist and own a physical therapy practice in Florida with 7 locations. Most of our patients are 65 or older, and we've been in the unique position of seeing how happy or unhappy they are with their Medicare plans. I want to give you my opinion, which is largely formed by listening to the thousands of patients that we've treated in our physical therapy clinics. I'll share a brief overview of the differences between traditional Medicare or Medicare Part A and B and Medicare Advantage, also known as Medicare Part C. Then we'll discuss some of the important issues that the insurance companies do not tell you. By the end of this video, you'll feel more confident about which one to choose. To start, I want to quickly clarify the key elements of traditional Medicare versus Medicare Advantage. When you reach the age of 65, you'll have to choose between enrolling in traditional Medicare Parts A and B or opting for a Medicare Advantage plan or Medicare Part C. Also, if you're already over 65, you'll have the ability to switch back and forth between one plan or the other during open enrollment, which is usually between October and December. That does come with some caveats though, which we'll get to in a moment. Medicare Part A covers inpatient hospital stays and home health care. Medicare Part B covers your medical visits outside of the hospital or home health care setting, typically referred to as outpatient. Everyone who has Medicare, whether you opt in to sign up for a Medicare Advantage plan or not, is responsible for paying their monthly Medicare Part B premium. In 2024, that amount was $174.70 per month, or just under $2,100 per year. Traditional Medicare Part B only covers 80% of your outpatient healthcare costs. So, if you go to the doctor, physical therapist, or any other outpatient healthcare provider, you'll likely be responsible for the remaining 20% of the costs. In order to avoid paying the extra 20% that traditional Medicare doesn't cover, many seniors enroll in a Medicare supplement or Medigap plan. These supplemental plans cover the leftover 20% that Medicare doesn't cover. There are different supplemental plans to choose from that offer different levels of coverage. This year in 2024, we asked our patients what they pay monthly for their Medicare Supplemental Plan G, which is the most popular plan we see, and that came out to about $325 per month, or if you do the math, $3,900 per year. Many also pay for Medicare Part D, which covers prescription drugs. For this, they're paying about $20 extra per month. The last thing to add when calculating costs for traditional Medicare is the annual deductible that the patient is responsible for if your supplemental plan does not cover it. This amount in 2024 was $240. So adding up the total average cost for traditional Medicare with a Plan G supplement and Part D prescription drug coverage, you'll pay around $6,250 annually, or around $520 per month. But the good news is you won't have many additional costs, if any, with this setup. Now, let's talk about Part C, or Medicare Advantage. These plans are managed by one of the major insurance companies like Blue Cross Blue Shield, Aetna, or United Healthcare. Essentially, what they are doing is taking your federal healthcare benefits, repackaging them back to you as a private insurance plan. Most of the time, these plans are advertised as zero cost to you, the patient. Medicare Advantage plans are also referred to as managed care plans and are more like traditional health insurance that you were probably used to before you turned 65. Some are HMOs, some are PPOs, and they'll likely have copays, coinsurance, deductibles, and out-of-pocket maximums. Based on the feedback from our patients, the annual out-of-pocket maximums for most of these Medicare Advantage plans ranges from around $5,000 up to $9,000, and you'll probably have to pay each time you see a healthcare provider, which averages out to at least $40 or $50 per visit. But this number can be much higher depending on the services that you're getting. The out-of-pocket costs will largely depend on how often you need to see a doctor, physical therapist, or other healthcare provider. So, if you're in great health and rarely need any healthcare services, then the Medicare Advantage plan may save you money each year. So, common sense tells us that you should just sign up for a Medicare Advantage plan while you're healthier and then switch to traditional Medicare if your health status changes, right? In theory, this sounds great, but what the insurances don't tell you is that when you turn 65, you have a one-time opportunity to sign up for Medicare and a Medicare supplement without needing to pass a medical exam to be medically underwritten. If you opt to sign up for a Medicare Advantage plan and then try and switch back to traditional Medicare and a supplement later in life, you'll most likely need to be medically underwritten. This means that if you have health issues, you may be denied and be forced to stick it out with Medicare Advantage. This exact thing happened to my grandma Mimi when she tried to switch. So, if you find your health issues are causing you to go to the doctor frequently, you'll likely end up paying significantly more for your Medicare Advantage plan than your total cost of having traditional Medicare and a Medicare supplement. But there is also a huge reason why our patients are becoming more and more frustrated with their Medicare Advantage plans. Many of the top healthcare providers do not accept Medicare Advantage plans. And to be honest, in our area, it's extremely hard to find a highly rated specialist who does. This means that if you want to go to a specific doctor or specialist or physical therapist, you'll be stuck paying out of pocket. Or if you have a PPO plan, you'll have a much higher deductible for providers who are considered out of network. The reason why many good doctors aren't in network with Medicare Advantage is because in order to make the billions of dollars in profit that the insurance companies make off of your Medicare benefits, they opt to pay far less to the doctors than traditional Medicare, sometimes less than 50%. These doctors have worked very hard to be the best, and they simply aren't willing to accept an amount for their services that doesn't allow them to pay their bills and run their businesses. You've probably figured this out by now, but based on the feedback from many of our frustrated patients, my opinion is to be very cautious when enrolling in a Medicare Advantage plan. I'm not going to tell you they are a bad choice at all costs, but you need to do your research before being swindled by the commercials or the sleazy insurance salesman who only tells you the benefits and leaves out the risks. So find yourself a reputable insurance agent who you trust. Also, call around to your top physical therapy practice, cardiologist, oncologist, and other specialists to see if they accept the plan that you're considering. Another great way to keep healthcare costs low is to check out this video about how to stay healthy and active as you age. Until next time.